this session. And before that, I would like to invite Dr. Manoj Mathur. Dr. Manoj is a leading glaucoma expert practicing in Hyderabad. He would be talking on the using technology for better outcomes. Dr. Manoj.
Yeah. Good morning, everybody. So today I shall be speaking a bit about using technology for better outcomes in glaucoma management. So it is not very uncommon that you prescribe medication for the patients and you ask them to come after 3 months. The patient finishes the first bottle and then stops using the medication. Then if you ask the patient to come for 3 months, the patient comes after 4 months. Uses for the specified follow-up time, that is 3 months, and then for the last 1 month, she doesn't take the medicine. Sometimes the patients admit to discontinuation and await further orders. That means they say that I could not come after 3 months. I finished the bottle 1 week back. I just wanted to have a reconsultation and I then start the medication again. Then sometimes the patient stops medication in between and restarts just a week before the scheduled appointment due to compliance factors. So how to go about it? So this is an app that is developed. What is Beat Invisible Beat Glaucoma app? Beat Glaucoma app is an exclusive personalized mobile app for patients and web-based platforms for doctors. And the objective of this app is to overcome the clinical challenges in the medical management of glaucoma and to simplify the disease management at doctor and patient level. So how is the disease management happens from the doctor's perspective and from the patient's perspective? From the patient's perspective, the patient has access to the mobile app. And from the doctor's perspective, the doctor has a web-based platform for this purpose. So from the doctor, what are the challenges that he faces? The challenges are for adherence of therapy. One is the dosage history. The patient is not very clear as to say that the patient is using the medication properly, and there is no concrete data to evaluate how regularly the patients are taking medicine. If you ask the patient, are you using the medicine? The patient says, I use the medicine. There lies all the difference. The verbal communication is the key. The patient database will minimize this verbal communication if the patient is using this app. And the irregular follow-up visits, like in our subset of patients, it is always important to need to remind the patients about the follow-up visits to have a proper schedule. And from the patient's perspective, what are the challenges that the patient faces? The patient faces, the first and foremost challenge that we encounter from the patient side is forgetfulness. The patient is that forgetfulness is cited as one of the major reasons for the barrier of adherence. The lack of information, the patient is not aware about the disease management. The patient is not too much aware about the pathogenesis of glaucoma because there is no magic result like in cataract surgery. Patient sees that I was what I am today. So the importance of medication and the economic barrier in most of the patients that the patient tend to not follow your medication as advised. Now, with this app, what are the benefits to the doctors? This app and the web-based system provides a personalized mobile application for the patient, the web-based platform to access, update and maintain patient database. The doctor, you can upload the IOP readings, the OCT, HVF and OD and Golio images can be uploaded. You can have a complete information about that patient. You can upload in your web-based system and that is automatically it is automatically seen in the patient's mobile app. You can track the patients for dosage history and it is excellent patient engagement and promotion tool. The benefits to the patients. The patient gets regular dosage and follow-up visit reminders with easy access to consulting doctors. The disease awareness and management information is incorporated in this app and the glaucoma vision simulator. The patient goes through this vision simulator. The patient understands the importance of the disease pathogenesis of glaucoma and the patient has less tendency to not comply with your medication as advised. And the frequently asked questions and patient education, 2 videos on glaucoma are incorporated in this app. From the patient's view, the the patient has access to Beat Glaucoma, the app. What does it offer? It offers daily medicine and dosage reminders. It has patient education material. It has a vision simulator. It gives the patient follow-up visit reminders. There is an IOP tracker inbuilt in this app, and this is a customized app. And it is available on iOS platform as well as Android platform. And from the doctor's perspective, it is a web-based system. It is a one-time easy registration for the doctor. It has quick access to the patient and medical profile and database. Patient's dosage histories can be uploaded, and the treatment upload from the web portal, which is synchronized with the patient's mobile app. So just let's have a small demo.
Follow-up visits. That's it. Medicine reminder. Patients can mark the medicine reminder as taken list or snooze. Patients can upload. Your personalized web page of Glaucoma.
So this is about the app and the web-based system for the doctors. It promises to be a good tool for the single practitioners and eye centers, but remains to be seen how this app features can be incorporated in the already existing EMR systems of institutions. With this, I conclude my talk.